So you're here today for TB testing?
Yeah.
The morning started early for county health teams at this tuberculosis outreach event in downtown San Diego.
All right, Mr. Adam, I'm going to have you sign right here on that line.
Nurses, communicable disease investigators, and epidemiologists were all working together to screen people experiencing homelessness who may have been exposed to tuberculosis between January to March.
Fever, any of the symptoms? None?
We have nurses who are interviewing our clients, screening them for symptoms that might be concerning for active tuberculosis, and then we have them doing a blood test or skin test, but we're trying to do blood tests as much as possible today.
It was pretty easy, fill out some paperwork and just a little pinprick and you're good.
Good morning, senor. Siéntate.
Tuberculosis is one of the top infectious causes of death worldwide, second only to COVID-19. TB is most often found in the lungs and is spread through airborne bacteria. When someone who is showing symptoms of the disease coughs or sneezes, another person can unknowingly inhale the bacteria.
Can you put pressure on there for me?
Oh, okay.
It takes an extended amount of exposure time to become infected with TB, usually over several hours or days. A shelter setting can increase the potential for infection.
People who are experiencing homelessness are in many circumstances more likely to be in congregate settings where they're sharing airspace with a larger number of people. So compared to a household of people who have stable housing where there might be 2, 4, 7 people in a household, people experiencing homelessness might be sharing a sheltered room with people with 30, 40, 50 people in the same airspace overnight.
But even if you become infected, you may not get sick right away because tuberculosis can be either active or latent.
Most people, once they become infected with TB, have no symptoms at all. If somebody's not sick and they're not contagious, we call that latent TB infection. Active TB, some of the classic symptoms are cough, fever, night sweats, or losing weight without trying to.
Good morning. My name is Jay and he's Ed. We're going to do your x-ray.
Tuberculosis is treatable and curable with a course of antibiotics over several months. But it can be fatal if left untreated, which is why screening events like this one are critical.
All right, Mr. Adam, you are done.
In the County News Center, I'm Anita Lightfoot.